Good evening, everyone. My name is Monica Uceda. I'm the Diagnostic Radiology Chief Resident at St. Francis Hospital in Evanston, Illinois, and former chair of the RFS Webinar Committee. I would like to welcome you all to the first session of the Leadership Webinar Series. This program aims to provide tools in strategic planning and problem solving, which may help trainees and early career physicians to make significant contributions to their communities. The series will comprise 10 online one-hour sessions and center around a variety of leadership topics such as negotiation skills, networking, mentoring, teamwork, work-life balance, etc. These will be presented once a month by leadership experts in our field. Tonight, we start off the leadership webinar series with the negotiation skills topic. I'm honored to introduce our very first speaker, an amazing colleague and friend, Dr. Gloria Salazar. Dr. Salazar is the Departmental Simulation and Patient Experience Officer of the Department of Radiology at the Massachusetts General Hospital and Assistant Professor of Radiology at Harvard Medical School. She also serves as the co-director of the Fibroid program in this institution. She completed medical school and diagnostic radiology residency at the Federal University of Sao Paulo and intervention radiology fellowship at Beth Israel Deaconess Medical Center. She has authored and co-authored several research publications, including her work in uterine artery embolization. Dr. Salazar is a member of the Women in IR section and a passionate advocate for diversity and inclusion in our field. She's a generous mentor and a fierce leader, and tonight she will share her experiences swimming with the sharks. Without further ado, please welcome Dr. Gloria Salazar.
Thank you very much, Dr. Uceda. That was a very kind introduction. Thank you so much. It is my honor to be the first guest speaker to this very important leadership series of lectures for you guys. I wish I could have that back in my day, and I'm hoping to show to you a couple of tricks and guidance for you to be able to bypass all the burden that sometimes we have as physicians because of the lack of non-technical skills, communication skills that we need to pretty much succeed in life in general. So thank you very much. So this is the first of, I think, a series of webinars. I'm very honored to be the very first presenter. And today the topic is negotiation skill and how are you going to navigate in swimming with the sharks. The next speaker will be talking a little bit more about communication skills. I'm going to just touch a little bit on danger of silence, but I know Dr. Roshan is going to do a more in-depth analysis of this, and I'm pretty sure the other speakers as well. I'm going to touch in a little bit of everything about leadership that as it relates to negotiation skills. These are my disclosures, and none of them are relevant to this presentation. So when I started my career back in Brazil, I was, the firstborn of an immigrant couple from Chile. And so early on, I realized I had to negotiate in my life. So I think I started negotiating, I guess, as far as I remember, when I was 7 years old, when I needed to get, toys or play with the boys and the girls. So my whole life has been negotiating. Of course, as all the physicians in the field, I always felt like the most important thing in going to medicine is just the procedural skills, particularly being an interventional radiologist. But then I realized with time that non-technical skills, which are the skills of communication, of leadership, of how do you work as a team, how do you negotiate for yourself, are equally important to succeed in a career. So this is a nice article which talks about simulations, which is one of my passions, about how does a physician go from a novice to an expert, and how important it is the combination of both technical and non-technical skills, and over time how does that curve advances over the years. So for me, I feel like I became, since I was a teenager, I always wanted to become a physician, and so my curve went back and forth with a lot of loops. It wasn't a straightforward curve. So for me today, my job is to make your curve a little bit more straightforward, or very much straightforward, by giving you some advice today. And of course, I preface this lecture in Twitter saying that I want to show you how Marvel characters, Madonna, and soccer relate to negotiation skills. So let's start right now. So I want to make you the best advocate for yourself, just as Captain Marvel, or maybe, if you wish, as Tony Stark, which is a very good businessman and also a great leader. And as you know, Tony Stark learns a lot of skills overnight because he's very, very focused on his on saving the world and other things that are he's passionate for. And speaking of Tony Stark, actually, if you check in this online, you will see 9 life lessons from that you learned from him. I just took the first 4 for today's lecture, which is pretty much basically, oh, so sorry. Pretty much is always learn, don't quit. So I think that's something that I always tell my fellows, my residents, my medical students. I tell my son that every day, please, 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 please. Failing doesn't mean that you cannot continue to move on. So please, you always learn from a situation, even if you don't succeed in a negotiation. For me, I've been more, I've been not that successful in negotiations if you count the number of times that I failed at them. However, the ones that were successful were really very meaningful to me and really propelled my career. So that's rule number 1 for me to you from the Marvel characters. But there are 3 other lessons that you should take with you, particularly when it comes to negotiation. And it's number 2 is know when to defer and listen. Sometimes you need to stop and just sense the ambience, the environment, so that you can actually make an advance and actually be successful. Also, listening positive. Channel your time and energy into something positive. Even if you feel defeated, even if you feel like there's some negativity in the work environment, you still can take something positive. But the most important of all is do your homework. Whenever you're negotiating, you really need to be prepared. You cannot just go there and present unless you're really, really very passionate and you're speaking from the heart, but that's very hard to come across effective. So I actually look up how to swim with sharks as a primer. There's actually a paper about that, and that teaches the swimmers how to protect themselves. And the first 2 lessons are, first of all, you need to learn that you're going into a waters that are infected with sharks, so before you start to swim. And the second one, whatever you learn in the books, you will learn it. However, you do need to practice. So for me to you, the same thing. We're going to talk a little bit about some basic concepts today, but you really, every time you think about negotiating, it's always best to practice before you go into any type of negotiation. So for today's lecture, we're going to have 4 key objectives. The first one is that because the environment that you work in is important, where you inserted are, it's very important for you to understand how people negotiate things locally. So the first objective is to understand local politics as your environment. The second one, most important as well, is identifying your personal career goals. You need to know what you want to ask for. And then this is followed by describing key communication skills to become a good negotiator, and also develop strategies of how to negotiate for yourself and for others. So these are the basic learning objectives. So let's start from the beginning. The definition of negotiation is, there's 3 components to it. The first one is a strategy to resolve a divergence. Sorry, I keep doing this with my presentation, sorry. A strategy to resolve a divergence of interests, real or perceived, it may not be real, where a common interest also exists. So that's a good thing about negotiation, is that even though there's different perspectives, there's something that brings people together. The second one is that it requires effective communication of goals, needs, and wants. So again, we're going to talk a lot about that preparation before negotiating anything. And then the last one, it also can occur between individuals representing themselves. So I'm just negotiating for my salary, or you can be a leader in your field and you're negotiating for a group of individuals. So we're going to talk about all of that. So in summary, we're going to be talking about what is the culture, how do you find out what is the culture of your workplace, which is important for negotiations, how to navigate those waters, and also why do you need to learn it? Well, let's go into the why directly. I think Dr. Uceda already alluded to the fact of the need for physicians to have leadership skills, communication, etc. So this is why we're doing these webinars for you. Communication breakdown also has a cost to the system, not only in healthcare, but corporations. If you do have communication breakdown, you have less efficiency of work. And that is a cost to the institution. So there's a lot of money lost in there as well. And also, there's a lot of papers demonstrating that many physicians feel uncomfortable when negotiating or when it comes to leadership skills. And that can actually detract them from professional opportunities. Other reasons relate to physician burnout. There's a lot of literature now on physician burnout. It's a real thing. And if you look into this paper, loss of control and autonomy, which has everything to do with your ability to be a leader, of your negotiation skills, actually makes people, is at the root of the problem of physician burnout. And we have known that for a little while based on surveys that are administered in big institutions. So this is a very important thing for us to know. And therefore, by having skills to negotiate or to have leadership skills, you're probably better equipped to not suffer from physician burnout, at least in that aspect. Other papers are showing the issues with academic medicine. So why people leave, or why is that physicians are not satisfied? This is actually a big survey that was completed back in 2009 with about almost 2,000 responses for different academic settings. The major issue that physicians related to when it comes to leaving an institution, like academic institution, related to having high leadership aspirations that were not met in their environment. So that's very sad that somebody actually, as a physician, early on in their career, decide to be leaders, but then when they go into academic medicine, they basically become disengaged or don't pursue that, and actually to the point that they even think of leaving academic institutions. So, and there are other things too, such as low engagement and self-efficacy. So hopefully we can change that by doing more training of physicians and changing a little bit the culture of healthcare academic institutions in this situation. So in my hospital, I'm very lucky because Mass General has long recognized the need for training of physicians. So they developed a leadership program, which I was part, and I was trained by leaders in the field, a combination of Harvard Business School, very prominent speakers, and also different local leaders. And I completed that after 2 years. And this is pretty much the core curriculum. And you can see that the conflict and negotiation strategies are at the core of this leadership course. So this has been going on for over 10 years, I think, for Mass General. It has been a very successful program. I'm pretty sure other hospitals do the same thing, but just to show you that there's light at the end of the tunnel. I think the most important reason why you should learn communication skills and you should actually have training and leadership skills is to make your life more efficient. The most important reason is your time is valuable. And when you're young, you think you have a lot of time in your hands, and you certainly do. But over the years, time goes by very fast. And this is just like a couple of years of my personal Instagram account, which I'm not sharing. And time goes by very quickly. Time is very valuable. Time, there's no money, you cannot buy back time. So I think for me in my career, I really value time, and I really value that if I'm going to go into a negotiation or undertake a project, I want to make sure it's successful. So I take a lot of time preparing so that that time is worth, that project's worth my time. All right, so let's start from the beginning. When I talk about this publication, How to Swim with the Sharks, the first directive is that you have to learn that you are in a water with a lot of sharks. So how do you know that you're actually swimming with the sharks? And you know, it's very hard for me to give this lecture and say, oh, Gloria is swimming with the sharks, but really, like, swimming with the sharks apply with any institution that has different culture or different politics, and that applies to every big institution in academic medicine. So all of us have our little bit of a shark pool, and we just need to realize we are in that. So if you're practicing an environment with local politics, ask yourself whether you're swimming with the sharks. So I have a very quick quiz for you to answer in yourself. The question number one is that if you are aware how success is measured and by whom in your organization, that's a very important question. The question number two is that have you observed that there is discernible pattern in according praises and assigning blame? The question number three, do you notice that some people get concessions all the time, Or do you recognize that there is not necessarily a strict positive relationship between performance and rewards? So if you answer yes to any of this, you're definitely swimming with sharks. And here's what the publication says you should do, obviously in real life. But there are a couple of things that I feel like are very important for us to know, are very useful for us as physicians. The rule number one: assume all identified fish are shark. So you really have to understand and get to know people very well so that you can develop trust and reputation. And there are other things that are very funny, such as, counter any aggression promptly. I don't think that applies to us, but it's kind of funny just to show this paper, which, it's actually something that I came across. But moving on in our lives, if you do feel, or if you answer yes to any of those questions, that you are swimming with the sharks, you need to build some protective gear. So for today, we're going to focus on those 6 things. Build reputation, a personal brand. What do you like to do? How do you like to represent yourself? Use the guidelines and rules in your favor. Obviously, you have to understand them first, according to the culture of your place. And know your value. That's a very important question for you to ask yourself. What do I bring to this institution? What do I bring to this team? And then last but not the least is always think about increasing your circle of influence and build positive relationship with your superiors. That's a very, very important one, and I'm going to talk a little bit about that. So let's start with know your value. This is how I bring Madonna into this talk. I'm a very big fan of Madonna, and obviously she represents a lot of the feminist sort of movement, I guess, in the United States and the world. But this particular song is very interesting because she really focuses about the fact that you need to express yourself in a manner that is direct and that represents of what you want. And part of the music is, it could really apply to us in our professional life. And basically, you do need to believe that you deserve the best in your life. And if something doesn't work out, is not right for you, then you just move on and go to the next thing. But then she says, second best is never enough. You do much better on your own. So I think there's a lot of value on this. And really, this is what I call express yourself. And here I'm going to show one of the books that I think are very helpful when it comes to conversations and negotiation skills. I would highly recommend this book, Difficult Conversations. I read it. It's part of my sort of a list of books that came with my leadership course, and I would strongly recommend it to you. And in this book, they talk about the value of expressing yourself with clarity and with power. Okay, you don't need to be a very good speaker. You don't need to have a lot of knowledge. You just need to be clear in your message and speak of what you see and why you see it that way. That's a very important, and I think sometimes people feel like, well, I'm just a fellow, I'm just a resident, oh, I'm just a junior attending, I didn't train here. Like in my case, I wasn't trained in radiology in the United States. So you always feel like, oh, maybe I shouldn't say this, or maybe that's not important. So that should be totally removed of your equation. You need to really bring this with clarity in your life. Moreover, Madonna talks about that song that I just showed you, Express Yourself. And then obviously she's talking about relationships, but again, I do feel very strong about this applying to professional life. People should always say what is that they want, of course, with respect and without, sort of frustration or feelings or anger. She talks a lot about that. And then sometimes you feel like if you ask too much or you go for the wrong thing, someone you care about, somebody would not like you. And I feel sometimes for me in my career, I always felt like, well, I always had a plan in my head, and I never fully expressed that plan with fear of retribution or kind of not being understood. So that's what we call when you censor yourself and you're not really being yourself. Sometimes it can go wrong. So it is very worth trying to understand what is that you want to say and what is that you believe in. And that's part of the negotiation skills, because when you go there to negotiate, at some point, everything else is going to fail and you're going to have to speak from your heart. So get to know that. So for me, the first thing is negotiating with yourself. So you really have to believe what you want is what you want to express, or what you want to work for, or what you want to fight for, is worthy of expressing or fighting for. Think about the concept. We are all equal. So a little bit of entitlement for yourself to speak your truth, to negotiate something, to get what you want, actually helps you. Not entitlement in a bad way, but just believing in what you want to say is really worthy of expression. So think about that when you're thinking about negotiating anything. So how do I know that what I want to negotiate, that what I want to have in life is worth it? Well, that is very hard sometimes. I'm still trying to figure out what am I going to do with my next 5 years in my career, but I kind of have an idea of what I want. But inside of you, you need to determine what is priority, what is worth fighting for. And you have to imagine yourself in that situation. If what you want to negotiate for is having a dream job, then dream about that job and see how you feel and see how it would look like in your mind. And when you know what that is, and if that resonates with your core values, then probably you're on the right track. And then you know what you want to ask for. And you need to be very specific when it comes to negotiation. If you're having any trouble finding out what is that you want, what are your core values, or what is that you want to negotiate, you can always go back of the question of why did you choose medicine in first place? For me, I chose medicine because I wanted to help other people. So for me, although there are many different aspects of medicine, such as knowledge, teamwork, contribution, flexibility, security, job security is a big one these days. I chose medicine because I wanted to impact the lives of individuals, families, and communities. So always go back to the core reason that why did you choose to be a physician in the first place, and why are you negotiating things for what you believe. And so for me, this is my roadmap to the world. So you can do that the same way that I did it. So you can write down what is important for you and write everything. In my case, for me, it's very important family and motherhood. For me, it's important to have professional development. I always want to be learning more. I always want to become better at what I do. I think that's a tenet of being a doctor these days. Also, equally important is the teaching aspect of my work, justice, service, arts, music, and sports. And with that, I would tell you I'm a big soccer fan, and I am I'm so passionate about soccer that for me, I study soccer and I know the teams and I know everything that happened since I was born in the World Cups. And to me, that propels me. And I'm really inspired by the things that soccer teach me as far as teamwork and other lessons. And so this is sort of like the picture of my values. And then what I do is I just translate this into my professional life. So right now I'm working in a combination at Mass General Hospital as an attending physician for 10 years. But at the same time, this work overlaps with the Society of Interventional Radiology, where I'm actually working actively towards diversity and inclusion, towards education, simulation-based training, and other things. At the same time, I'm working a lot to improve and to give back with global health initiatives and industry and technology development. So for me, this is my world. This is where I live. So anything that I'm going to negotiate from here on has to do with that core value for me. And with that, I actually think that you should write down, not right now, perhaps at the end of this talk, what is your core value? What is your 2-minute elevator talk? What are you all about? If right now you're looking for a job and you have to envision what this job is, just write it down. So, hey, I am a third-year resident. I want to do interventional radiology, and I want to work with academics, and I want to be doing research in liver metastasis. I don't know, liver tumors, which is what I wanted to do in the beginning. A 2-minute elevator talk is something that I learned almost 10 years ago how to do it, and you won't believe how far you can get with this 2-minute elevator talk. This is from the UC Davis. And this is the definition. An elevator speech is a clear, brief message or commercial about you. It communicates who you are, what you're looking for, and how you can benefit a company or organization. It's typically about 30 seconds. It's the time that it takes for people to get in and out of the elevator. For me, I had so many conversations in the elevator talk that led me to meet people that are amazing. I kid you not, I met my mentors at Mass General. I actually developed relationships, collaborations that actually took me where I am right now. And you won't believe how many people you would meet in the elevator in your own hospital, the CEO of the hospital, the chief, the CMO, or the chief diversity officer, or your boss, or somebody that you're working in another department that is doing the same thing that you're doing, but is just waiting for a collaborator. So please have that ready for you. And last but not the least, always think broad, increase your circle of influence. I start with a Minecraft castle here because I know that my son, who is 9 years of age, has a Minecraft world made just for me. And the name of the world is Mom's World. And I have a dog named Benzo in that world. So he's a major influence for me. I learn a lot from him. But my circle of influence goes outside and beyond Mass General Hospital. I have very good friends and mentors within Mass General Hospital, including my chairman and a lot of my colleagues. But I also have a lot of friends within the United States, within the SIR, and outside of even the USA. So it's very important. Keep connected, connect, and what resonates with you. Connect with people that think the same or think differently, but you have the same agenda. With that in mind, I also want to bring attention to you in your environment. You have to be very aware of your social network. These are the people that work in behind the scenes, and they make things happen, or they may block your agenda. So you need to know who are these important people are or individuals are. And it takes a little while when you're starting a new job or when you're in training to understand who the players are, but it's important to be very attentive to this environment. So you need to know who the important individuals are who are going to support you or block your agenda. You need to understand how are these individuals related and how can you use this network to help you and to overcome a problem or to achieve a goal. And last but not the least, build positive relationship with your superiors. They are there to represent you. You are there to represent them. You are all a team. So please understand the big picture. If you don't know the vision of your chairman, of your chief, of your director, you need to ask specifically, what is your vision? You need to understand what the big picture is, because whatever you negotiate has to be in alignment with the institutional goals and what the big picture is for your chairman. Also, it's very easy for us nowadays to just complain. Please, if you complain, if you bring an issue forward, I'm not saying don't do it. I think most of the part that I'm going to present with you today is speaking up. You do have to bring things forward, but please bring solutions and alternatives. This is always very welcome. You know, people don't want to just listen to problems. They want to listen to how to solve them. And always center the conversations on the patient. So use the guidelines and rules on your favor. Again, you need to understand where you're practicing. So know your workplace mission statement. I know MGH mission statement. I know that in the mission statement, we talk about not wasting anybody's time. Speaking of the issue of time, right? So we want to be effective. We want to use people as a team on the best way possible. Also, where I'm inserted, I have a clear understanding of the my promotion criteria when it relates to academia. So Harvard Medical School has everything in a website. I know exactly how, or at least more or less how what do I need to get promoted to the next level. If you don't know any of this, please seek for guidance early on. You need to know those things to move on in your career. So I'm going to go a little bit and talk about communication skills when it comes to negotiating. You have to be clear communication. You have to not be afraid to speak up in a proper manner. And I'm not going to talk about dealing with feelings, but please don't let frustrations build up. If you are frustrated about a situation, speak to somebody who can help you. Don't let it blow up, because that's not going to be helpful to you. And always negotiate with facts. So in that regard, say what you mean and don't make anybody guess. Tell your story with clarity. Don't present your conclusion as the truth. Share where your conclusions come from, just like a paper, just like a scientific paper. To get accepted, you need to show why is that, you prove that the conclusion was made that way. And don't ever use, and I just used it, always and never, because that's not going to help you in any negotiation. It's too much exaggeration, and people are not going to like it. If you look at this slide, which talks about the astronaut having a problem, you see a clear difference when you say, in terms of being clear, Houston, we have a problem. And then say, Houston, I feel like we have a problem. So which one of those calls are you going to respond to if you are on Earth looking at the astronauts? I'm pretty sure you're going to choose the first one, Houston, we have a problem. And I find this very hilarious. This is another book that I think is funny. I have not finished reading yet, but it's from Jessica Bennett, and talks about this issue of communication and how do we use the verb I feel very often. And please shy away from using I feel like in negotiations, because that's abstract. There's a lot of theories of why we use that, particularly women, but I know men do so as well. Instead of saying I feel like, just say I know and I believe. Of course, there's more compromise when you use I know and I believe, but that's what you should use in a negotiation. I feel like at work is simply wimpy, weak, and wishy-washy, according to Felix Mendel, which is a professor that studies languages. The other advice that I give you that somebody gave me when I was a resident in Brazil, don't sit on the fence. You can sit on the fence, it's very comfortable. You don't go to one way or to the other. You're just looking at the other people, but you need to take a stance on what you believe. If you sit on the fence too long, the fence may break. You're not going to be very secure there as well over time. So please take a stance. If you believe something is wrong or right, take a stance. Nobody likes people sitting on the fence. They want to know what you're up to, who you're all about. And with that, I would introduce the topic of speaking up very briefly. This is from Martin Luther King. Speaking of the issue of speaking up in the sense that when we become silent about things that matter, that's when our lives begin to end. There's really no purpose in life. Speaking up is a major issue in healthcare. It threatens organizations, the culture of safety. People don't speak up for many different reasons: lack of knowledge, fear of retribution, fear of intimidation. We did a study and simulation to understand the barriers for staff not to speak up and to speak up. We put the people through simulations, physicians, nurses, and technologists of contrast reactions, and we challenged them with things that were clearly wrong to see if they were going to speak up about an issue. So basically, we put people through anaphylactoid reactions, and then we put actors doing wrong things, clearly wrong things, and we observe whether they would speak up or not, and if they did, if they feel comfortable or not. We measure, so this is what we did. We did the 2 different scenarios, and then we basically evaluated response before and after. This was part of the survey. So there were many things that we considered that people, that are a barrier for people to speak up, including knowledge, teamwork, communication. Lack of communication skills was a major one. Relationship and personality of superiors. Sometimes you don't feel comfortable talking up or speaking up to your boss. And we actually provided an intervention to those participants in simulation. And the intervention was using advocacy and inquiry, which is a term used in business. And I think it's a very helpful term that you can use to negotiate anything in your life and to speak to people that are making decisions about your career. So advocacy consists of an objective observation paired with a subjective judgment. So for example, in the case of treating a patient with contrast reaction, you see that something went wrong, you would say, I saw you're administering Benadryl to this patient with laryngeal edema. I think the appropriate treatment would have been epinephrine and oxygen, and Benadryl slowed down the administration of epinephrine. So you make an observation, you follow that with a judgment, and usually the judgment in terms of negotiation skills is a guideline, is a benchmark value, is data. It's something that we know exists and everybody believes in. And then you follow that by an inquiry, an open-ended question. So I saw you administer Benadryl. Patient was having laryngeal edema. In that case, it's better to administer epinephrine and oxygen, and the Benadryl might have slowed down the treatment. What are your thoughts? How did you see it? I wonder how you saw it. What's your take on that? So you're asking the person, where is she or he coming from? And that way, you don't need to say, hey, you did the wrong thing. Please, let me just manage this. So that's very rude. That's very direct. So there is a way of talking. There is a way of communication skill that you can actually speak up to others. So we found that people feel very comfortable after the intervention was done during the simulation training, and they changed their views on social acceptance of rejection, penalty and repercussion, and relationships with superiors. These were the three significantly changed scores after the intervention was provided during the simulation. And so in conclusion for us, it was really important to do this study to evaluate what matters to people when it comes to speaking up, and how do we change that by promoting simulation training and giving them a communication skill too. So negotiations for yourself, it can be salary support, promotion. For a program, you have academic aspirations, you want to build a research program, or as a leader, maybe you're the chair or you're the chief of your division, you're negotiating for people. First thing in this last 10 minutes of this presentation, don't do it in negotiation. Don't ask for favors. You ask for favors when you really need it. Or don't make a negotiation look like you're asking for a favor, because then you're going to fail. And what I mean by that is that, I need to have, for instance, recently I negotiated something about my conference time. I was invited to give this lecture in an international conference. It was very important to me, to my career. And so I had to ask for time off. So I asked in terms of negotiation to my chief. Obviously, my chief is very supportive of me and understood. I didn't ask that as a favor. Oh, you know what? I need a favor from you. That never goes well. And also you need to be clear about what you want and how do you going to benefit the department by going to this lecture, or benefit your career, which is in turn benefiting the careers of your leaders and your superiors. Don't ever threat. Don't ever say, this is what I want and I won't take anything less. That's not good for negotiations. Unless you really have a good job, a second job offer that is amazing, I would never do that. Don't bluff. Don't complain. Like, for example, a lot of people during negotiations say, I've been doing the work for 2 different physicians and I'm being paid the same thing. That never goes well. And please, 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 that goes without saying, don't beg. That's not part of negotiation. So there's 2 different negotiation approaches. One that is position-oriented and frame-oriented. Position-oriented is basically when you're, pretty much buying or bargaining. It's called distributive bargaining. Basically, it's focused on positions. It's a win-lose game. You either win or lose. The pie is set. There's no more to gain. And it's a one-shot deal. It doesn't take in consideration relationships. That's not a very good strategy. I usually like the frame-oriented for healthcare and for all my businesses. It's focused more on interest. There is a win-win that is possible because this is an expanding pie. So you're collaborating with other person. You're bringing more to more gain to the whole group. And this is more focused on ongoing relationships, and it's called integrative bargaining. For me, I prefer that, and I'll give you an example of that. Back in 2013, I decided to, together with my colleagues in OB/GYN, start a fibroid program where we will see the patients together. There was a lot of resistance when it came in, to the distribution of the pie. And so my pitching was, listen, the pie is only going to grow if we do an integrated fibroid program, just like a multidisciplinary tumor clinic. And it's going to be more patients for you and more patients for me. But ultimately, we're doing this for the patient, because the patients are seeing 3 different consults before they decide on a fibroid treatment. And that shouldn't be that way. And also, like, after we started the fibroid program, then we understood a little bit better of the value of integrated practice units, which is essential for IR. But pretty much took us like 1 year to kind of get everybody on board. And one of my promises as a co-director was, I'm going to show you the data. We're going to review the data every month. And if there is some injustice or the pie is being shifted more towards one end than the other, we're going to change that. So here's the data that I share with them. So the referrals increased a lot. Like when we started the program here, this is a P chart, and then after the implementation of the program, so the pie grew for everybody. So they were very happy with that. We also grew our pie, like UFIs per month increased. And not only that, the patient's consultations, days to consult and to procedure reduced. So this was even obviously a win-win for the patient, for the providers, everybody was happy. And this is the feedback that we got from the patients, all positive, and from the providers. So again, a win-win situation. And this is the volume. I kept this in every meeting just so that everybody, would trust me that we were doing the right thing. So very successful program. It will still continue, and this is a way of collaborating and negotiation and collaboration. Now, how about negotiating for yourself, salary or first job? This is a great paper that I would recommend you to read from just recent. And it talks about 5 different competencies. And networking being one important part of your job search. I think all of you know that. But also identifying a BATNA. And for those of you who don't know or not familiar with the term, BATNA refers to best to a negotiated agreement, which is a plan B pretty much. I think you should always have a plan B. I always have plan A, B, C, because everything that I negotiate, I always think about whether they're going to give me or not what I want, and if they don't, what is the best case scenario, and then how do I deal with this? This is a very important when negotiating. And then competency number 5, and when negotiating a job, it's important to understand what you're negotiating, your interest, what is valuable to you, vacation, benefits, salary. And it's important not to get entrenched into a particular position, be flexible, and always use data to support what you're asking for. And that's hopefully relatively easy for you to obtain. What about if you're negotiating a raise or promotion? Well, first of all, I think it's always important to know your strengths and weaknesses. All of us have them. And this is a little bit of a square, like a way of knowing whether you should work on your weaknesses or not. But also determine what you want. Again, we've been talking about this. What do you want? What resonates with you? What is that you want to achieve in life? And I think it's very important also to understand your chairman's, your chief's need, to see how do you contribute to that and how do you actually ask for a promotion or a raise. So in order to make your case, I think these are three very good examples. So always present yourself as a team player. Don't talk about me. So instead of saying, I feel great about what I accomplished last year, say, I feel great about what we accomplished last year or this year. So showing that you're a team player. Also use data. Based on my productivity last year, I'd like to propose that, I have a physician assistant. I have more support administratively to, work with more patients. So always use data. This is a good one for negotiating salary. The standard inflation rate is X. Based on my productivity last year, I'd like to discuss an increase of X, Y, and Z. Always use data. This is how you make your case. Very straightforward, clear. What has worked for me is, again, using data and facts. I always go to a discussion knowing what I did, what I can do, and what is the potential for growth. I always send an email before I meet with somebody about a negotiation, explaining clearly what I want to achieve in that meeting. And always make it about the team. Always use we, not me, not I. Focus always on collaboration with other departments. I'm very lucky that I work with very closely with the vascular surgeons and the OB-GYN team. So for me, that's a natural. And very important, know when to stop talking. So once you pitch in a proposal, you were clear on your goals, then stop and let the other person who's negotiating with you talk. Okay, sometimes they are waiting to give you that promotion, and you just need to stop talking and let them talk. There's another model that was described for surgeons in healthcare, which is pretty much the other one is similar to what I already presented, but again, it goes back to the same issue. Problem-solving exercise. All of us have problems. We need to just find out how are the solutions and how we can make everybody happy, and focus on more of the things that are common as opposed to that we don't agree. So then when you go to a negotiation that is problem-solving exercise, you have to identify everybody's need in the negotiation, establish the best alternative to a negotiated agreement, and set clear objectives for the negotiation, identify their strategies and tactics. The strategic skills of a negotiator, again, you need to know what you need, what the department needs, what your boss needs are. You need to prep, focus on the areas that are common ground. Usually don't focus on the areas of conflicts, and define objectives, but be flexible, be direct. Okay, I want to work on X, Y, and Z, and have some flexibility. Don't always stick to, oh, this is the only way that we're going to get the center going. If you give me $100,000, that's not going to work for you as a negotiator. Even when you're negotiating, when you prepare, during the meeting, you're going to find different challenges, and you really have to use this last one, which is active listening. Active listening is important to feel the room, to see where you're going to kind of either master or a negotiation, or you're going to have to back up a little bit and bring more arguments forward. And as a final thought, when you're negotiating, this is not war. This is not who wins and who loses. There's no losers. There are probably only winners. And you really have to come up with a balanced, mutually acceptable solution for all parties. For me, I've been in Mass General for 10 years. I know everybody that I sat on meetings and negotiated with. You don't want to come out of a meeting making enemies. You want to come out of a meeting being collegial and having people to trust you and your power of leading or of creating new projects. So in summary, for this webinar, I would strongly recommend you to find out within you what is that you like, what is that you want first. You're not going to get a good deal if you don't know what you want. Evaluate the needs of your workplace. If you're already in a workplace that you want to continue to be and you want to become an attending in that place, talk to people that have been there, that you need support, and you want to really understand if you really want that job for you. Proper language and communication skills are key. Having a plan B, a BATNA, is very important because things can change and you can learn from it. And always value relationships. Don't go into a negotiation to fight. Please don't. This is about being collaborative. This is our people that are working with you. Okay, so you're in the same team. And ask the right questions. If it comes to a very difficult negotiation, try to find out where everybody's coming from, and active listening helps in that. Last but not the least, be happy. Happiness on the job is the only thing that you can keep up, that you can do to keep sustaining high levels of passion, performance, and productivity over the long run. If you do what you like and you're happy on the job, you're going to be successful and you're going to be able to negotiate better. Moreover, if you have meaning in your work, you're going to actually produce better outcomes. There's some publications talking about this, healthcare workforce to find joy and meaning in their work and improving the experience of providing care. And that's what we all want to do. And last but not the least, there's no reason in any type of negotiation not to follow your heart. That has worked for me. You know, of course, preparation, communication skills, knowing my environment. But really, when you follow your heart and you know what you want, that's probably the most strong argument, the most successful thing you can do for you. And last but not the least, I'm going to have to finish with a very good quote from my idol, Pelé, Brazilian soccer player, one of the best in the world, if not the best. He worked very hard to become who he is. And he says, success is not an accident. It's hard work, it's perseverance, learning, studying, sacrifice. But most importantly, it's loving what you are doing or learning to do. And I'll leave you with that. Thank you very much for this opportunity to share my experience with you.
Dr. Salazar, that was absolutely great. I can speak for everyone in the audience that this was a much needed lecture. I don't think we've ever heard something like this in general in SIR, probably a few in SIR, but it's hard to find the time and the right person to give us these lectures for RFS, and we are very, very grateful. We have some questions coming in. Let's see. So one of them says, this is Bryce Bodel, regarding the BATNA strategies, do you recommend always having a sort of standardized plan ready to be used in the event of unplanned negotiation situations?
So I usually tend to play, it's like simulating the negotiation, right? So I always have a plan B. And the reason being is, you know, a very good friend of mine, a family friend of mine, when I was a teenager, told me, you have to, you know, look up to the skies to reach the top of the mountain. So sometimes in negotiation, and I didn't put that in my presentation, you ask for a little bit, I sometimes ask for my ideal situation, which I know sometimes is going to be probably difficult because of money, because of whatever. And then out of that ideal situation, I get my plan B, which at the end is pretty good for a plan B. It's not the perfect world, but it's a plan B. So it depends on how you go about your negotiations. Like, you know, you put your salary very high and then you get, you know, I don't know, 70% of that, but on top of that, you get in benefits. You know, so that's sort of a good plan B. But I think it's good to have a plan B psychologically, and also because you may want to negotiate, kind of start a negotiation to the plan B, you know, when you're talking to somebody about that.
All right. So let's see. That was Dr. Bodel's questions. Dr. Chan says this is a wonderful webinar. Thank you. Dr. Kutsenko has a question. Dr. Salazar, this is an amazing talk. Thank you for so many great points. Would you recommend anything on how to hold a positive, effective conversation with people who are actively trying to block the negotiation effort? That's a really good question.
Yeah, I have a lot of these. My experience, and so there's two parts of that. The first part is that you know somebody's blocking your agenda. And it may be a one person only, or it may be a status quo of the culture. Let's say there's no money. There's no money, everybody's struggling with that. When it's something like that, that is well known, like we're undergoing recession, right? So, you know, then you can work with it. So what is possible and what is not. But if there's a negativity around somebody blocking your agenda, again, first of all, don't lose your cool. You know, always use data and facts. All your arguments have to be centered on one topic or one point that it's basically a strong point. For me, it's always been patient safety, patient experience. I'm the simulation of the, the Office of Patient Experience. So when you tell the story, when I tell the story of how my patients struggle to get an appointment with me because in the past, because they speak another language other than English, and our phone does not have an option for an alternative language other than English, that resonates with people on the table. Even if they don't want to give me what I want, they're going to have to work it out. So I'm not saying exaggerate, just use your facts. Just, again, you know, just present the facts that they are and why it is important. We are all working in healthcare. Ultimate goal for us is to benefit patients, the health of populations, the health of communities. So try to use a little bit of that, and again, don't lose your cool. I mean, just understand that some people are going to be like that, and you know, actually these are good people for you to train your skills.
I have other couple questions. When is a good time to negotiate your first job? Is it during the interview? Is it after, when you sign the contract? When would be the most appropriate time?
You mean when you're in training, how to negotiate your first job?
When you're about to get off of practice and you're being called for an interview for your first job ever, fellowship, when is a good time to negotiate what they're trying to offer you?
Okay, so that's a good question. A lot of my fellows ask me that. So there's two things. Job search are hard out of fellowship. I think that if this is a job that is your dream job, in your mind, whatever that is, okay, let's say I've always wanted to work at Mass General. I've always wanted to be in Boston. That is my dream job, and I'm being offered an interview. If that's your dream job and you know that you want that, I would just try to push it in the first interview. I mean, you really want that. You need to show them that you want that. If this is one of the many kind of interviews that you're going to have, or it's not your top place, I would say, you know, maybe hold back, figure out what is that they're offering, look at the place, talk to people. And then, yeah, that can be your BATNA, that can be your plan B, maybe. So it depends on what, if you really want a job, or if you don't. If the stakes are high, then you should probably be I would be a little bit more aggressive, but always, you know, trying to understand how much, maybe not in the first, but just introducing in the first job interview, you know, what would be always starting with the benefits is a good thing. Nobody's going to argue that having benefits, it's a good thing, you know, and it's not aggressive. It's like, oh, what are the benefits? I'm wondering what are the benefits in this place. Start from there, and then you can kind of go into the salary if that's, you know, if that's what you want to aim for right away.
So is it better to negotiate a specific amount, like the salary, or is it better to negotiate the perks? Like, should we care about how it comes off? Does it look better to just negotiate perks and not the amount?
So for me, I think, I mean, perks are perks. I mean, I think it's very benefits and whatever, the vacation time, the conference time, academic time, all of this is in the equation. You know, sometimes just the salary doesn't represent the full benefit that you're going to get from the job that you're looking for. And that has happened to me when I look, you know, when I look around and I'm like, oh, I could make more money other places maybe, but then I look into the whole package of my institution, including my relationships with, you know, my colleagues. You know, it's the whole package really. I think, again, you know, I think goes back to what you value the most. You know, some people, some jobs would offer you tuition free, you know, for your kids. I mean, I never thought of that when I was looking for a job when I was 10 years ago. I'm like, tuition free, why do we need that? But of course, I only have one child. But if you have four, maybe that's a good deal. And the salary is a second, you know, a second plane, second, you know, second reason for why you will get the job.
Do you have any tips or tricks to negotiate without coming off as a selfish partner in your institution?
Yeah, so always, so if you want to negotiate for yourself, salary promotion, again, know what you have produced so far. Like, okay, I've been doing, like, for me, we've been working on this. This is what we've accomplished last year, thanks to, you know, the work that we've done in this clinic, and clearly it's your work. You know, always use the word we in this department, we in this, and of course it's embedded that it's you. And the last thing, I would say, you know, don't be afraid of being aggressive, um, as long as you're presenting sort of the facts, not your feelings. So I feel like again, like the feel conversation. I feel like I should, you know, be promoted because I've been here 10 years and you know, I am the last one to go home every day. So that doesn't mean anything, right? I mean, everybody can stay late and work, but what have you produced? Well, what have you done in this 10 years? Unfortunately, this is the way that we operate. And of course, relationships are value and connections, but what have you produced? What is the value that you bring? And the value not always on money and publications, but, you know, why it is important to have Dr. Salazar at Mass General at the IR section. And you need to know that value. And again, it goes back to the what I presented in this lecture, know your value. Everybody has value.
Okay, and I have one last question here. In terms of getting to know your superiors and their mission statement, how do you go about sharing or introducing your vision for the department? Is that something you should avoid doing early on?
No, I think you should always do it. That should be your, you know, just because our chairman and our institution has to have a mission statement, you have to have your own. You don't be afraid of sharing. I've always been very upfront about what I believe. Equity of healthcare for everybody. That's always been, I mean, everybody who knows me at Mass General knows that I'm all about diversity. I mean, I'm a Hispanic physician practicing in Boston. So you need to find what is that you're representing, what is your core value, what is your mission. I wouldn't be afraid of sharing that with anybody. If that's what you meant in the context of negotiating, or in the context of getting to improve your or increase your circle of influence.
All right, I think we've covered all the questions. Thank you again, Dr. Salazar. This was amazing. We learned a lot. Certainly now that I'm in the process of looking for a job, this was very, very helpful. Thank you to all the attendees for being here. Don't forget that our next speaker will be Dr. Rushan. He will be touching on effective communication skills, the danger of silence. This will be on June 26th at 8 p.m. Central Time or 9 Eastern Time, and we'll get the ads rolling probably the first week of June, so we remind you of that. And thank you all for participating. Thank you, Dr. Salazar.
Thank you very much for inviting me. And if you guys have any questions, please email me. I'm happy to help. And I know I have been mentoring a lot of people. I'm going to get back to you, I promise, if you're in the webinar.
All right. Well, thank you very much. Have a good night, all.
Thank you. Have a good night, everybody. Bye.